Okay, hello and welcome everyone. So in this video, I'm going to talk about the options for reform or the ideas of reform in the American healthcare system. So we have results from polls indicating that about 75% of Americans are pretty satisfied with the medical care they receive. However, if anything, they would like guaranteed access at a lower cost, which is really difficult to provide for all the reasons that we've so far discussed. Underlying this is a moral question. Is medical care a right? So many people have put forth the idea that medical care is a right. Interestingly, we want to think really carefully about the issue of access to medical care from the standpoint of a moral framework, to be able to distinguish between rights and individual rights and social responsibility. In particular, we want to answer the question of or observe what type of right this medical care would be. So we have a really important distinction between negative rights and positive rights. And ultimately, no matter how you'd answer the question, you'd still have to solve the fact that we have finite resources. There is scarcity. And so this opens up the issues of a tragedy of the commons problem, where there's overconsumption of whatever is the resources, and then the resources are exhausted, or a free rider problem, which can happen in a public goods situation where you have too many people accessing the good without paying for it. So if you take the position that healthcare is a right, well, that'll miss the distinction between a negative right and a positive right. More accurately, a freedom-preserving right, which is a negative right, or a resource extracting right, which is a positive right. Negative rights say, well, what you can't do to limit somebody's freedoms. Positive rights say what you're compelled to do. So the issue is that, well, if healthcare is a right, healthcare is actually a positive right, meaning that if somebody has access to healthcare, somebody else has to be compelled to provide it. Then we have a question, okay, if we're going to provide, we have healthcare, we have a healthcare system, who ought to be covered? And if we're going to go back to sort of solving some of the moral questions, we have a problem. There's a really big confusion about public opinion. So what's our perception of fairness? Is it equal access to providers? Is it equal health outcomes? Or is there something else entirely? So it's really difficult thinking about who ought to be covered, what access should look like, and then further complication is who ought to be paying and how much. If we expand access, good, but then that increases spending. Ultimately, no amount of preventative care or better record keeping will overcome the problems of moral hazard that would ultimately come, leading to increases in spending. So we want to think about, well, how should we think about the delivery of medical care? Is this primarily something that responsibility should be borne by the individual or by the group as a whole? And this is something we need to settle sort of at the society level. In terms of policy options, well, most people favor the idea of expanding insurance to all, and there's three possible paths to do this. So maybe creating a single-payer system, maybe expanding existing government programs like Medicare, Medicaid, and then in this other one. Maybe mandating insurance coverage either individually or through the place of employment. Or maybe expanding the use of market incentives to encourage and enable individuals to purchase insurance. So all these different things, well, these paths will change the incentive structure, sometimes in predictable ways, sometimes in unpredictable ways. And that's something for policymakers to pay attention to, is how is this actually going to change the benefits and the costs involved, and how are people actually going to respond? People, both patients as well as providers.